We are group 2 and our topic is artificial intelligence in healthcare. So we're going to start off by the introduction and then we'll review some background, go to our expert interview, discuss IS topics and implications, then our group opinion, solution, pros, cons, and then we'll finish up with our conclusion. Artificial intelligence stands as a transformative force rapidly reshaping industries. Recent advancements have solidified its role as a lasting distributor, particularly in healthcare. The implementation of AI into business information systems promises improved data analysis, automation, and decision-making assistance, offering healthcare organizations the potential for enhanced productivity and improved patient care. However, the convergence of AI into established information systems requires careful evaluations of its pros and cons, with ongoing adjustments essential for success. Despite human skepticism towards change, addressing the need for improvement, especially in a nation with high healthcare spending and poor health outcomes like the United States, underscores the necessity to explore AI's potential as a catalyst for a much needed transformation within the healthcare industry. All right, so some background. The background of artificial intelligence in healthcare reflects a historical reluctance among physicians to adopt technological advancements, exemplified by their initial hesitancy towards electronic medical records, such as EMRs. And despite the proven benefits of EMRs, enhanced efficiency, error reduction, and improved organization, physicians have still been slow to embrace such technological shifts. The historical resistance raises questions about the potential concerns surrounding AI technology adoption. So one of the key challenges will be adapting our organizational strategies within the healthcare industry. So some impacts and factors. One significant consideration is the required adjustment in organizational strategy as the integration of AI alters business processes and information systems. So we focused on Porter's Five Forces framework, which illustrates that if AI proves effective in reducing errors, improving efficiency, enhancing patient outcomes, and lowering costs, this will necessitate a shift in the competitive strategy of healthcare firms, which also needs to be taken into consideration. Um, the historical context of resistance to technological change also will provide insights into the anticipated disruptions accompanying the incorporation of AI in healthcare. So we just need to make sure that we're anticipating the change and really look towards focusing on some of the hesitancies that physicians have in healthcare.
For our expert interview, we spoke with an executive recruiter specializing in the healthcare technology industry. In summary, they noted significant stress on AI tech by private equity and venture capitalist investors behind the healthcare tech firms. AI tech has high value and is being seen as key for some startups and smaller firms seeking to be acquired or to go public. The recruiter also expressed concern with AI innovation plateauing or slowing down unless it's widely accepted. So we need to get physicians to accept this and actually roll it out. To relate it to an information systems topic, AI or artificial intelligence, AI is a disruptor to the healthcare industry. It's going to disrupt the status quo. This technology is going to significantly change the way current processes are performed and would completely change the organizational strategy of the industry and competitive strategy of the firms within. For the organizational strategy as defined by Porter's Five Forces, it would shift based on ripple effects from AI tech. For example, the threat of substitutes would shift based on new technology that becomes available. And by reducing errors, improving efficiency, improving patient outcomes, and reducing costs, this would allow firms to increase their value margin. These actions are selected based on a firm's competitive strategy. AI is key to enhance business processes, and AI also belongs in business intelligence systems. AI tech can improve clinical processes by streamlining and organizing medical records, track and record communication with patients, document and track test results, and can even enhance and guide diagnostics. This is all achieved by applying AI tech within business processes and business intelligence systems. For a group opinion, we feel that AI can process information at least 1 million times faster than human brains. And that's phenomenal. That's an amazing capability, and we need to embrace it with caution. Artificial intelligence is here to stay. This technology can learn, and we're responsible for ensuring that it's learning accurately and being utilized correctly. We can utilize this technology in a wide variety of industries, but healthcare in particular within the United States would benefit because of ongoing shortages, high costs, and poor outcomes. For our solution, we suggest embracing AI. Healthcare professionals and information systems experts need to work together to create systems tailored for the healthcare industry's needs. This should start with increased automation right off the bat, but continued research should be performed regarding assisted diagnosis, et cetera. One system is not going to fit all. Each division of the industry likely needs customization. AI specialists need to meet with physicians to stress that this will improve human-to-human connections and interactions within healthcare instead of just making it a colder interaction between patient to physician.
Next, we'll be talking about some pros with artificial intelligence in the healthcare sector. The first one is efficiency. AI is able to automate administrative tasks as well as other time-consuming tasks. This allows medical staff to spend more time with patients and/or less time being overworked with menial things to do. With faster processes comes increased capacity since less patients will be stuck in clinics and hospitals. This technology can also be integrated well with virtual care and can be expanded throughout the country. The next thing we'll be talking about is cost. AI can reduce the cost through eliminating blanket procedures and improving data-driven decisions tailored for each patient. There is also a cost associated with poor outcomes and increased unnecessary testing that will be reduced with AI use. Another area is better outcomes. AI can better organize data and even assist with diagnoses. AI has the ability to detect small changes in imaging tests that may otherwise be missed. As discussed previously, AI can also improve the reach of virtual healthcare, where so many more people can be treated in a faster time frame. This means that AI has the potential to increase population health and reduce the poor outcomes that we are currently seeing. Through increased efficiency and better outcomes, patient and medical staff satisfaction should improve. These processes also bring new jobs to the industry and help relieve chronic shortages. Now we'll be talking about some cons that are related with AI in healthcare. The first one is cost. Implementing new technology will be expensive, particularly when you're getting rid of legacy systems. The next area we'll be talking about is resistance to change. Physicians were hesitant to have their paper medical records transferred to computers. This new technology can potentially help them diagnose patients, yet it may meet resistance based on human nature and concerns for safety. Another area is errors. AI is a learning-based technology, and unfortunately, sometimes it can learn the wrong thing. This means that a small bias can amplify when relearned, leading to more errors. The last con that we'll be talking about is privacy. There are still concerns over the software and what security risks this poses for patients if proper precautions are not in place. In conclusion, artificial or augmented intelligence is present, and there are countless upcoming decisions regarding how best to utilize it. The technology will continue to grow, but the directions in which it is focused are not set in stone. The promising benefits of AI tech in healthcare include enhanced patient care, cost efficiency, system improvements, and time savings. These are not guaranteed if the technology is not used properly with business process and business information systems. Lack of communication and monitoring could lead to poor outcomes and costly disasters. This technology should not be feared and should be continued to be utilized going forward with potential drawbacks in mind. This is our presentation, and thank you.